Thank you very much for the award. I really appreciate it. The next person we have for public comment is, I'm sorry, give me the name.
Ms. Hayes.
Ms. Hayes, please. Thank you.
Good morning, LSU Board of Supervisors. Speaking of Dr. Martin Luther King Jr., one of my favorite quotes of his is, the arc of the moral universe is long, but it bends towards justice. So just hope that we can all keep that in mind as we move forward in our lives. I know we don't have much time, so I'm going to get right to the point. Firstly, I'd like to express my disappointment that as a resident of New Orleans, I had to drive 325 miles yesterday at my own expense and on short notice to attend this meeting regarding a development on a publicly owned building in my city. I'm not sure if the board is aware that despite multiple assurances from Governor Edwards and Commissioner Darden for a fully transparent process and robust public input, this is the first public meeting regarding Charity Hospital New Orleans adaptive reuse since LSU and the state shuttered the building in 2005. And that's despite the fact that the hospital was sparkly clean and ready to reopen just 3 weeks after Hurricane Katrina, as well documented in the film Big Charity. Its closure impacted residents in incalculable ways. It shut people out of health care, resulting in increased sickness and death. LSU demolished an historic neighborhood and displaced an entire community. LSU eviscerated vital psychiatric treatment and care and stabilization services for seriously mentally ill people in mental health crisis with no full replacement. Yet instead of inviting residents to the table to help heal that wound, this new process has exacerbated the disappointment and distrust of the community. Per number 4 on the agenda item, as someone with extensive knowledge about Charity Hospital's closure, I was hired as a consultant to help advise on what fleshed out to be the Spirit of Charity District. I can assure you that at every meeting, the public were told that discussion about the building itself was hands-off. As a result, the petition began to the governor, the commissioner of administration, the LSU Board of Supervisors, Mayor Cantrell, all city council members, and state and congressional leaders representing District B that reads, as a resident of New Orleans, as a resident of Louisiana, I urge that you ensure no further development of Charity Hospital or ancillary buildings occur until there has been a complete and robust public input process conducted by an impartial third-party agency on their adaptive reuse. I urge that you support scrapping the ongoing LSU Real Estate and Facilities Foundation process and instead support the reissuing of a request for qualifications and a request for proposals only after soliciting ideas from New Orleanians and only after completion of a thorough health, environmental, and social impact assessment study in the area bounded by Poydras Street, Loyola Avenue, Basin Street, Bienville, and Claiborne Avenue. I urge that in the name of, if the name charity is to be used to memorialize any redevelopment of the area, you support only efforts that focus on uses that meet the needs of those in crisis, the underserved and the under-resourced, achieving and surpassing the 279-year legacy of its predecessor, reflecting the true spirit of charity. If I hadn't been driving all day yesterday, I would have printed a copy of the petition to give to you. I would also have printed a copy of the redevelopment proposal by Healing Minds NOLA to transform Charity Hospital into a one-stop shop mental health care and research center of excellence to address the epidemic of untreated serious mental illness. I'm thrilled that CMS has now offered states IMD waivers that would allow Medicaid to reimburse institutions for mental diseases with more than 16 beds for adults that would make that proposal a reality. To conclude my short comment, residents want the redevelopment of Charity Hospital to be based on community needs, not developers' pocketbooks. Thank you.